Bismillah ar-Rahman ar-Rahim. Today we are going to discuss the primary dental health care. In order to show what does it mean primary health care, we should pass to the meaning of primary health care in particular. Primary health care is defined as a new approach to health care which came into existence in 1987 and become core concepts in the World Health Organization of goal of health for all. These services are simplest and efficient with regard to cost, techniques, and organization that are readily accessible to those concerned and that contribute to improving the living conditions of individual families and the community as a whole. So we have to say that essential health care based on practical, scientifically sound and socially acceptable method and technology, and also universally accessible to individual and families in the community through their full participation and at a cost that the community and country can afford. So the concept of a primary health care involves concentrated effort to provide the rural population of developing countries with at least the bare minimum of health services. Now, what are the concepts of primary health care? As we have said, involves concentrated effort to provide the rural populations of developing countries with at least the bare minimum of health services. What are the principles of a primary health care? There are 5 principles of a primary health care actually. Those are equitable distribution, community participation, third, focus on prevention, 3, 4, appropriate technology, and 5, intersectoral coordination approach. Equitable distribution means health services must be shared, usually equally, by all people irrespective of their ability to pay, rich or poor, urban or rural must have access to health services. Community participation means the overall responsibility of the central and the state governments, the involvement of individuals, family, and the community in the promotion of their own health is an essential ingredient of primary health care. Focus on prevention means health services and its funding must shift from medical dental care to prevention. Whether medical or dental care should be care to prevention and health promotion. Appropriate technology means defined as what does it mean? Defined as technology that is scientifically sound, adaptable to local needs, and acceptable to those who apply it and those for whom it is used on that can be maintained by the people themselves. Finally, intersectoral coordination approach means a major reason for failure of Many oral health programs, as they operate in isolation, that means they separate from the general health care structure. Health cannot be solved by health sector alone. So social, economic, agriculture, food integrated with general health. For example, smoking affect heart disease, respiratory disease, and oral disease. Now let us coming to show the elements of a primary health care. What are the elements? ما هي العناصر of a primary health care? The elements are: number one, education concerning health problems and method of preventing them. We have to know what are the preventing measures in order to prevent all these problems. Second, promotion of food supply and proper nutrition. We have to promote the procedure of having or collecting food supply in order to help in preventing the disease. So the second point is a promotion of food supply. Third, appropriate treatment of common disease and injury. We have to collect large information about the appropriate treatment of common disease. Otherwise, we cannot do any help in health care. So we have to know the treatment of common disease and injuries. Fourth, supply of safe water and basic sanitation, because all of us know the safe water is the essential pillar of general health, so we have to do a basic sanitation and supply of safe water. 5, maternal and child health care, including family planning. Maternal child health care is essential pillar of the community health, so we have to concern much about the maternal and child health care. 6th, immunization against major infectious disease. So the immunization is very important to cut the cycle of distribution of the disease, as we have now in a problem of coronavirus. We cannot find any immunization for such a disease. For this reason, the disease is still distributed among the general whole population of the world. 7, prevention and control of locally endemic diseases and drugs, because every country has some sort of endemic disease among them. We should know what are the preventive measures to prevent such endemic disease. So we are coming to primary dental health care after having an idea about the general primary health care. So it will be so easy to understand what does it mean primary dental health care. The dental primary health care is a dental health may be defined as a state of complete normality and functional efficiency of the teeth and supporting structure, and also of the surrounding parts of the oral cavity and of the various structures related to the mastication and maxillofacial complex. Now let us come to primary dental health care. What are the steps? should follow. The steps, those are 4 steps. Conclude in socially, technically, economically, and politically. As regards the socially, the community itself must take the principal role in primary dental health care activities. It is the responsibility of dental profession to teach the people that they should not regard dentistry as simply the provision of services to relieve pain and restore function and appearance, but they must be motivated to use preventive measures themselves for birth to old age to keep the teeth in healthy mouth. The lectures and audiovisual aids can be imparted to small groups of individuals in the community at regular intervals in different areas of village. As regard technically, oral health teams must be developed which enable both dentists and auxiliaries to guide their community population towards desired level of oral and general health through the development of an appropriate primary dental health system. Dental schools, again, dental schools in some countries produce dentists who are also able to render primary oral health care. Dentists or medical doctors with appropriate oral health information should act as leaders of the whole health team. As regards the economically, what does it mean? Those responsible for dental health care services must develop systems which utilize the sources available to provide a level of dental health care for everyone. Many countries shows that a high proportion of their dental health budget is spent on a small proportion of the population. A sound dental health program in each country must be planned to be equally spread over the entire population. As regards the point politically it means primary dental health care cannot be developed without the full support of national resources, and to become a practical proposition, every country must show the political will be examined here health priorities of the total population. Now here let us say what we shall do to make the community must primarily be educated about the dental primary health care. So each community must primarily be educated about what in order to become a healthy community. Those points are as follow. Number one, the benefit of fluoride in reducing dental caries. So we have to show the community, to every individual in the community, what is the benefit of fluoride in order to manage the dental caries in as one of the principle of primary health dental care. Number two, various oral hygiene measures for removal dental plaque. Number three, correct food habits for the children. Those 2 points are very important to prevent caries and the plaque as regard to the hygiene and the food habit for the children. Harmful effect of habits such as smoking. The smoking habit, all of us know that is one of the important cause of producing the plaque and other unhealthy condition for the teeth. So harmful effect of habits such as smoking. Number four, early recognition of precancerous lesion. Example, ulcer in the mouth, not healing for 2 to 3 weeks, should be considered as a highly causes of oral cancer. We should prevent it by any available way. Number six, importance of regular visit to the dentist for routine examination in order to discover any precursor, any diseases cause the following or updating mouth disease. Now let us concentrate the important basic dental services in order to run through the program concerning those services. Number one, when the condition of the community are considered at the level one, consider emergency dental care as limited exam, related diagnosis, and palliative treatment. This is level one. So when we asked about what is the basic services for level one, we have to say limited exam, related diagnosis, and palliative treatment. Level 2, primary care includes commonly based services and clinically based services as oral hygiene instruction, selective use of caries preventives as fluorides and sealant. Level number 3, secondary care. It means secondary care. This means simple restoration, pulp therapy in primary teeth, anterior teeth, endodontic. Those are level 3. What are the level 4 steps? This is limited to rehabilitation. It means complex restoration built up, surgical extraction. What is level 5? Rehabilitation, it's restricted to molar, endodontic, or fixed bridge. What is level 6? Complex rehabilitation with placing implants, third molar extraction. Up here we have finished with primary dental care. What do you mean by primary dental health care, and what are the steps, and what are the level of services which provide to people inside the community given below 6 or 7 steps. I hope to see you in the following lecture. Wassalamu alaikum.